Hi everybody, it's Victoria. I wanted to talk about a couple of things today, but the two big ones were about FFS surgery or facial feminization surgery and skincare for my face and things that I've done to keep me looking okay. So if you have noticed, I don't know if you can tell, but I have no makeup on my face. I cleaned my face, I washed it, moisturized it, and that's it. There's nothing on my face at all. That's important because I'm going to be showing you before pictures and really scary surgery pictures. So if you're squeamish at all, don't watch the rest of this video because there's some pretty scary pictures of me right after I had my facial surgery. I'm going to go into a little bit more detail about all of them and the benefits, their costs, and what they've done to me, and then I'll also talk about skincare. So if you're ready, this is what we're going to start with. We'll start with FFS and then we will go on to the other stuff. So I had, I think, 5 procedures done on my face all at the same time. I had what's called a lip lift. So right underneath my nose, they made an incision. It goes from one end to the other, and then the doctor cut out a small section of it and he raised the lip. So he made the space between the nose and the upper lip shorter. That is one of the telltale signs, I guess, of a more masculine versus a more feminine face. So no pain, very easy. That surgery does make a bit of a difference. One of the benefits is that it actually lifts the lip upwards a little bit. So it increases, at least it makes the lip look a little bit bigger. The upper lip will look a little bit bigger, as well as minimizing the space between the nose and the upper lip. The second surgery I had was a brow shave. So most men have a thicker brow bone than women, kind of like that Neanderthal look, you know, if it's really, really thick. I didn't have a significant one, but nonetheless, it was shaved down, so it's more flat. So let me take my glasses off and I'll show you what I mean. So if you look at it from the side, there's no bump now. If I can actually feel it, it's almost entirely smooth. That is another telltale sign. Another thing, one of the other surgeries I had, probably the biggest one actually of the group, was I had a hair advancement forehead surgery. It's kind of a combination of the two. When they're doing that, they also do the brow shave, but that surgery is they pretty much do an incision from here all the way around to the other ear. They deconnect the scalp from the skull. They bring it forward and then they staple it and then they reattach it. And then at the same time, what they're doing is they're also raising the eyebrow. So some guys, more masculine feature is when the brow is lower. This, what it does is it raises the brow. So it increases the space between the eye and the eyebrows. So aside from, there's 2 benefits there. One is that your hairline, especially if you're already balding, brings it forward, which I was. And then the second part of it is that the eyebrow actually goes up. Another benefit of that is that there's no wrinkles there. If you know, I'm 45 years old and I usually pass for less than 45, which is pretty nice. I gotta say, it's been a pretty good thing. Even if I raise my eyebrows, I can't really get a wrinkle, which is great. One of the negative parts about that is right after the surgery, I'm pretty much from this point all the way back was totally numb. So I had no feeling. I am 2 years out from that surgery and the top of my head is still numb. This back part is still numb. Slowly what happens over about a year is you start getting a little bit of feeling, but the nerves had to be severed. So the nerves all across that scalp part were totally severed and they grow back over time. that is definitely a negative. The top of my head is still numb, so yeah, it's not the best thing. So if you bump your head, you can really hurt yourself. So I had to be super careful. The other thing I had done is I had a chin and jaw shave. So what my doctor did is, so there's no scars on the outside. He went through inside my mouth on the outside of my bottom teeth, and he made an incision. So he cut on the inside of my mouth all the way from one end to the other. And then from inside the mouth, he shaved the chin and the jaw to make it more of a triangular shape. So, you know, guys have kind of like that squarish jaw. And of course, all of these things, some of the most beautiful women have square jaws. So it's not really any one thing, but when you put them all together, it changes from a more masculine face to a more feminine face. I also had fat taken out of my thighs and they were put into my lips. That wasn't probably the most beneficial surgery, to be honest with you. You can always do lip fillers and that kind of stuff. I had bruises on my thighs for a very long time. I actually still have the dots from where the fat was removed, and they put them into your lips. Now my lips are more full, definitely, but you can attain that from just lip fillers and stuff. And over time, your collagen actually builds up in your lips, and you can actually have those big Angelina Jolie lips anyways. So those were all the surgeries. One of the surgeries I didn't get, which was the cheek implants, because I actually have quite high cheeks anyways, so I didn't really need to do that. That was one of the options. One of the other options is a nose job to make your nose smaller and narrower. My nose was okay, so I didn't really want to touch it. Overall, I think that was all of it. I'm gonna post in here somewhere all the pictures of what I looked like right after surgery and the recovery parts. I might even put a timeline in here just so that you can see the development. Right after surgery, I've never felt that kind of pain before. It was absolutely atrocious. I couldn't close my mouth. My throat and my mouth were so dry, like the Sahara Desert, and there was just no reprieve. I had to sleep vertically, sitting upright for 3 weeks. I was on Percocet for that entire time, every 4 hours. I could take 2 pills every 4 hours, but it took an hour for the pills to work. I would sleep for 2 hours, then I would wake up from the pain, and then I'd have to wait an hour, take another pill, wait another hour for the pill to start working, and then fall back asleep again. Percocet is terrible, made me feel pretty dumb and pretty sluggish. Aside from that, also it doesn't let you go to the washroom, so that's days, and you have to take all these laxatives and antibiotics and all sorts of, I was taking like 15 pills at one point right after that surgery. So the recovery from that facial surgery was really tough. Luckily, my sister was here to take care of me. It was also during COVID, so there was nobody going out or seeing anybody anyways. But again, it was a really tough recovery. At the same time, it's temporary. So I recovered and it's done. So once you go through the pain and you've recovered and everything's fine, I mean, I look totally different than I used to look. So a huge help was that facial feminization surgery. I had it with Dr. Dupre in Toronto. He is an amazing surgeon. And now facial stuff, like how to take care of skin. I'm not by any means an expert in this, but I never wear foundation. My skin is pretty good all the time. I don't break out. I'm very fortunate. But my routine is pretty simple, to be honest with you. I wash my face with a very mild moisturizer, and then, what's the word? Anyways, I wash my face, not with soap, I wash my face with a cleanser, and then I slather on some moisturizer that I've got. I'm not even sure what it is. I had like a couple of placenta creams and a couple of the other creams, but even just regular basic, you know, cream that I got from Costco is more than good enough. I just put a lot more than probably most people do. So that's my advice. I would put 2 or 3 times. Aside from that, I have had a couple of facial procedures to kind of correct some of the problems that I've had from laser and electrolysis, because it really bangs up your face. The laser I've had obviously on my jaw area and neck, and electrolysis as well for the white hairs, because I'm old and I've got white hair, so I've had to get electrolysis for that. So if you're trans and you want to do all these things, do it before you get white hair, because it's a pain in the ass. Electrolysis is expensive and it's painful and it sucks. So laser is still painful, but it's way faster. So that's definitely the better avenue to take. I also had Halo done twice, and I'm gonna get it done one more time. Halo is a very kind of new age, very powerful laser that's resurfacing of the skin, and I've had a couple of facials and stuff like that. But overall, I would say taking care of your skin is pretty easy. Wash your face with a gentle cleanser, put tons of moisturizer, keep yourself out of the sun, and that's pretty much it. I know some people use toners and all that stuff, and I probably should start, but I'm way too simple for that stuff. So if you have any questions, you can definitely put a comment down in the comment section. I'm gonna put some pictures up as well, so you can see what I looked like before and what I look like during, and you can see what I look like right now. I'm gonna do a nice close-up with no makeup, no glasses, so you can see what I actually look like. And I'm gonna put the picture of all the pictures of me beside, so that you can see what the difference is. So you can see, I don't know, I'm gonna look at this, and you can see, I'll turn this way so you can see what it looks like, and you're gonna turn this way and see what it looks like. So this is after all the surgeries, all the procedures, lots of electrolysis, lots of laser. My skin still is in decent condition. I mean, I still have to go to laser and electrolysis here and there, but for the most part, it's done. So anyways, I hope that was informative. If you have any questions, let me know. Obviously, like and subscribe, and talk to you soon. Bye, everybody.